Health and welfare benefits of overseas Filipino workers. Mabuhay! Welcome to our channel. If you work in the Philippines, hospitalization and sickness can cause your emergency funds and savings to be depleted. The cost of hospitalization and medicine can shoot up beyond the limits of the benefits from your full health. You do not need to worry much in most foreign countries if you are an OFW and get sick or hospitalized. Health and welfare benefits are among the major advantages you get from the government or your employer or both. When you become an OFW, you are supposed to be covered by a healthcare insurance by your foreign employer. This is one of the obligations that the POEA, Philippine Overseas Employment Administration, mandates employers. Many countries also provide more health benefits on top of the insurance coverage you get from your employer, which may include free healthcare for you and your family if they are living with you. Developed countries apply different approaches to provide universal health benefits and welfare coverage to their citizens and residents. Some have a single-payer approach, wherein the government shoulders the healthcare coverage of people. Other countries rely on private insurers. Another group of countries like the US employs a mixture of both approaches. The United Kingdom is a benchmark country in terms of the healthcare it provides its residents. Its universal healthcare system funded by the National Health Service, NHS, provides free medical care for all. From ambulance service, emergency room visits to hospitalization, surgery and chemotherapy, the NHS guarantees care for all. The prescription drugs are free or very cheap. In the U.S., there is Medicare, the federal health insurance program for people age 65 or older, people with disabilities, and kidney patients with end-stage renal disease or permanent kidney failure requiring dialysis or a transplant. European countries top the list of countries that have the best public healthcare systems in a survey conducted by Pew Research Center. According to its study, the top 10 countries that provide excellent healthcare benefits in their order of ranking are Finland, Norway, Sweden, Switzerland, Canada, Denmark, Germany, Netherlands, Australia and United Kingdom. Many of these countries provide free healthcare, which is paid by the government. Almost all the countries in the list belong to those that are considered best place to live in. Again, the countries that figured in the best list for an independent survey on a separate and specific aspect of quality of life are the highly developed countries within the top 15 of the Humane Development Index ranking, HDI in short. If you are an OFW whose family is not living with you, the higher wage you receive will allow you to be able to afford medical care for your family. If the members of your household do not have health and medical insurance, you can enroll them in a good program that will give you better peace of mind when somebody in the family gets ill or is hospitalized. You can let the insurance that you paid for worry about the medical expenses. Depending on the features of your health insurance, you can also have your family avail of regular medical and dental check-up and laboratory tests. It is a preventive health practice that will ensure the health of your family and keep illness away from them. Social welfare benefits for the people in developed countries abound. The U.S. is again a very good example. It uses the taxes paid by its citizens and migrants to provide assistance to help the economically needy families, especially those with children under the age of 18. There are state unemployment insurance programs that give unemployment benefits to workers who are unemployed not due to their own fault and who meet the eligibility requirements. Assistance to low-income families to afford decent housing are likewise provided. There is food assistance in some states, health insurance to senior citizens 65 years and older, people with disabilities, infants, children and teenagers, access to scholarships for higher education, and a lifetime pension that will allow the pensioners and their dependents to live comfortably. The United Kingdom is just as generous as the US in providing welfare benefits to its people. It has the Personal Independence Payment, PIP, a benefit program designed for children and adults of working age 16 to 64 to meet the costs of having a long-term problem or disability, including daily needs. It provides attendance allowance, tax-free benefit for people with disability aged over 65 years old. There is the Employment and Support Allowance, ESA, a benefit given to people who are not employable due to illness or disability. Carer's allowance is another welfare benefit for persons who care for somebody receiving a disability-related benefit for at least 35 hours a week. It has housing benefit that can help individuals or families. Housing benefit can help low-income individuals to meet the costs of rent. They are just two examples of developed countries where welfare benefits are generously provided for their people's benefit. Qualified OFWs who work in similar countries likewise get to receive most if not all of these welfare benefits, so much so when they become permanent residents or citizens. If you like the video, please subscribe to our channel, like and share the video. Click the notification button to get notifications for future uploads. Join us on Facebook, Instagram and other social media. Links in the description box below. Salamat.